So as well as having multiple myeloma, which is where the plasma cells in the bone marrow cause damage to the tissues, which may be the kidney, the bone marrow itself and causing infections and low blood counts, or maybe the bone causing fractures and bone pain, we have a number of related conditions. In those related conditions, there isn't actually any damage to the bones or the kidneys or infections. There's a high number of these abnormal cells within the bone marrow, but not enough to cause that damage. And so those patients need monitoring very closely, and particularly because unfortunately some patients can go on and develop the damage. Now, there are a number of what we call risk factors, so a number of measures we can take to try and determine whether a patient will go on to get full-blown myeloma and have some of those damage. That includes doing the bone marrow test and quantifying how many plasma cells are in the bone marrow. It includes doing measurements in the blood and also doing some scans and some x-rays. And importantly, we know that many patients who get diagnosed with a little protein band in their blood actually will never have any problems, and so may not need any monitoring at all, or may need to go to their doctor every 3 months or every 6 months for monitoring. There's then another proportion of patients who we're not sure whether they may go on and get damage. And so we need to monitor those patients very, very quickly, very stringently, and closely, because clearly what we don't want to happen is for those patients to go on and get damage to their bones or have problems with infections. And so we usually monitor those patients every 3 months or so to check that they're well, but also to check that their levels haven't changed. The different conditions have slightly different names, okay? And so we have something called smoldering myeloma. That's the condition which is closest to developing problems. It doesn't mean that all patients will go on to develop problems, but it's the one that needs the most monitoring. There's then another condition where there's less cells, and that's called monoclonal gammopathy of uncertain significance. And the reason they use the uncertain significance is because we really don't know whether those patients will go on and get problems. That condition, also known as MGUS, is actually quite common. So it can be in over 5% of patients over the age of 70. So there's a fair chance that many patients will have that, but it will never give them any problems at all. So it's important to talk with your doctor and find out which of those boxes you fit into, so that you then know how closely you need to be monitored, but also to know what symptoms you may need to look out for. Because many times you can help your doctor in the monitoring by reporting issues and problems you may be having.